This is Steve's Horse Show.
Yes, this will be a good one. Make your kids proud. Make your kids proud.
Okay.
Make them laugh.
Oh, that's tough. Okay. Welcome to Steve's Horse Show. This is the best episode yet.
Ever.
I like it, and it's come a long way.
Even though you hate the dentist.
Yes,
I don't let your dentist.
But I know. I'm sorry, Dr. Hogg. You're amazing.
I'm gonna tag him. I'm gonna figure it out and tag him.
He is amazing. I just don't particularly love my mouth being worked on. But all of my patients are sedated for dentistry, which that's
so we need to
that's
talk
a
to him about
benefit.
that.
Yes,
You could probably sedate yourself.
I
before you go.
probably could, but I think you get in trouble for stuff like that.
Cut.
Yeah. On your own horse.
If I screw something. Ricky, I'm going in for surgery. Film this.
Lateral excursion. So you make sure the front teeth are touching and side to side like this, and see how we've got good grinding ability here. So if you want to grab the top and bottom jaw, make sure they're touching, and then just go back and forth. So see how those smoothly go back and forth without going like up
So
and down.
if it's bad, then it'll be like a.
Yeah, or it will be locked in. Now, how I look in the mouth, I don't recommend always doing this unless you are pretty comfortable and the horse is pretty good about it. Because sometimes they're going to have some canines here, so you have to watch for those. Okay. There are no teeth behind the canines to the first premolar here, so you can grab the tongue and pull it out the side of the mouth, like this, and kind of push the mouth open.
Gotcha.
Without getting your fingers back where
in between.
Yes, where the premolars are. And obviously right here, they can crush your finger really easily.
Right.
So you use the tongue and kind of open the mouth there, and then you can look in there. Use your hand to push the mouth open right here. Kind of like you were asking to put a bit in there. Then you can see quite a ways back there without...
You need the headlamp.
Yes, you do need the headlamp. Yes.
Hello everyone, welcome to this episode of Steve's Horse Show. I am your host, Steve Cook, and today we've got another doctor. I'm so tired of being the dumbest person in the interview, but today we have Dr. Charlotte Ken, and she is going to talk to us about dentistry. I have to be upfront with you. I do not like the dentist.
I don't particularly either.
Cool. So we can get along.
Yes.
However, we're going to talk a little bit about, how does someone know, to call someone out to do dental work to their horse, and what is the progression that you use when you come out to someone's farm? So I guess for starters, how does someone know, I need my horse's teeth worked on?
So we get calls for several reasons. One would be decreased performance. So they're fighting the bit or they're not turning.
So a lot of performance horses is where you start with.
A lot of performance stuff. Or older horses, they're losing weight. They're dropping a lot of grain. They're tilting their head when they're eating their treats, things like that.
So that would be, some signs that, you see is definitely dropping weight. You hope that you would catch it before that, because at that point it's been, a few weeks or months too late. Yes. So talk about the bit. What would a horse, what would be some signs that, you might think that you need to...
Okay. So all of a sudden they seem to be kind of, especially in the dressage and English performance horses, they're locking their jaw against the bit because their teeth are kind of locking together, and when they try and flex their jaw in a certain position, it gets locked in. And so they're leaning against the bit and they're heavy. Or,
is it almost like they're sore?
Yes. Yeah,
okay,
they can be sore or turning a certain direction or performing a certain
So they're favoring
maneuver.
to one side?
Yes.
Gotcha.
Their head will tilt, maybe because it's pinching the soft tissues in the mouth, or it's cutting their tongue or something like that.
So I know that every horse is different, so this might be kind of hard to answer, but if someone has never had their horse worked on, and maybe someone's had their horse worked on a bunch of times, general rule of thumb, do you work on a certain time? Do some horses have a certain routine that you work on them?
So most horses, we look at them once a year.
Gotcha.
On an annual basis, they should at least have them evaluated, and a lot of times that requires floating once a year. Some horses, if they have some sort of dental disease, then it's going to be every 6 months.
Gotcha.
Or they're older or really, really young. People think, I don't really need to get them done until they're 5 or 6, but really some of the youngsters need it a lot more often as well. But most horses are about every year.
So if someone has like a 3, 4, 5-year-old horse, when do you think is a good, if they've never had issues, and they don't even recognize any problems, do you think that they should have an evaluation at a certain age?
Yes, we like to look at them when they're yearlings, and then again every year after that.
Gotcha. So you try to evaluate them once a year
Yes.
if you can? Gotcha.
Yes, we typically do it when we're doing vaccinations or some sort of other annual exam.
Gotcha.
We'll go ahead and take a look in their mouth and talk to them about all the dental issues.
Right.
The horse's history. So what kind of performance does the horse do, or is it just a pleasure horse, or does it hang out in just the backyard? What issues have they been having as far as any sort of performance related, weight loss? Are we tilting our head? Are we giving us any of those signs? And as I'm doing that, I'm also looking at the horse and kind of taking a general overall impression of the horse. Do they have any abnormalities of their head, the way they carry their head? I'll actually usually watch them eat as well to see if there's any issues there. And then once we go through all that, then I start to evaluate their mouth too.
Wow. So talk about what you actually do, like with the actual mask, and it's kind of a scary looking, crazy deal. Talk about what you're actually doing. You got your front set of teeth, and then you're trying to get to the back.
Yes.
Back set.
So the metal thing that we put in their mouth is called a speculum, and that sits, their incisors sit on those plates, and we open that up so that we have full exposure to all the back teeth. Because a big thing is being able to see them all.
Right.
If you just go in and feel, you may not find everything. So we use a combination of both seeing it and feeling.
Right.
So that works on the incisors to hold their jaw open without putting pressure on one specific tooth.
Gotcha.
So it kind of distributes it over all those teeth. We're able to open the jaw and they cannot snap it shut on us, so that's nice for our hands. So from there, once we know what we want to take off and if there's any other abnormalities going on, then we will use the power float, which is a spinning carbide discs.
Gotcha.
And we go along those teeth very quickly. We don't hold it on there very long, and we remove those points. And we just remove them down to the level of the tooth or just a little bit above on the cheek surface and the tongue surface on the lowers. And we do not take off the chewing surface, like I said.
Sure.
And we make sure that we get all the points out of there. And then we also evaluate the very front tooth and the very back tooth, because it's common to have hooks and ramps. So
Right.
if they have a little bit of an overbite or underbite, we want to adjust that there.
Gotcha. That's pretty much it.
Yeah.
And talk about the smoke too, because that's pretty
Yes.
crazy if someone's never seen it before.
Yes.
A new horse owner or something like that.
Right. So because it's
I even called it smoke.
yes,
It's not smoke, Ricky.
It's not smoke. So when we're floating them, because it's spinning and it's a diamond carbide disc there, it pulverizes the points, and so it comes back out as a dust.
That's a pretty extreme word.
Pulverizes. Okay, maybe that sounds a little too
She
dramatic.
got into that.
Okay, so not
Just think of a
pulverized.
synonym for
Pulverized.
pulverized. It
Grinds.
Grinds their teeth
How about
down.
that? Okay.
little less extreme.
So, okay, yes. So when we use the disc against the tooth, it grinds the point down and it actually turns it into a dust. And as they're breathing that out, that's what you'll see come out, especially on a cold day like today. You also see them breathing.
Right.
But we do not create smoke. We try not to create any heat at all in their mouth. We're very careful to only stay on there for a very short period of time.
Gotcha.
You've got 10, 11 seconds before you're heating that tooth up too much. So we're moving from tooth to tooth. We'll cool the disc off in between. We cool their teeth off.
Oh, so that's why you're dipping
yes.
it back and forth.
Yeah,
okay,
we clean
gotcha.
off all the material off of it, and then we're also cooling everything down. Because the worst thing you can do, well, two things. One is take off too much tooth and expose
Right.
sensitive tissue, or heat it up too much because you'll kill the tooth.
Gotcha.
Yeah.
Oh, wow.
Yeah.